am the co-chair of the webinar committee, along with Megan Gonzagowski, who is also on today. We will be going over WebAds, except for numbers. I will not be going over the numbers today. It'll be Miss Melissa Keller, previous past president of the AFMA. She is going to do the institutional side of WebAds for those of you that are institutional coordinators or just want to know, like, what is it that the DIO and admin do on that end. And then I have Amanda. I'm going to butcher your last name. Is it Gentilla?
Yeah, Gentilla.
Okay, Gentilla. She is going to kind of go over, how to add residents, how to add faculty, what is needed on that part of WebAds. And then I will kind of clean up the bottom end with osteopathic recognition for those of you that have osteopathic recognition. What are the specific things that you need to do for WebAds to update your osteopathic recognition stuff? So that's kind of what's on the docket for today. Hopefully, you guys, if you have questions, feel free to put them in the chat, or there should be like a question and answer at the end of each kind of segment. So feel free to hang on to your questions until that point comes, and then we'll get as many of your questions answered as possible. Okay. Let's hand it over to Melissa. It's all you, girlfriend. Thank you.
Thank you. So I'm Melissa Keller, like Becky said. I am currently the executive director of GME at Prisma Health, and I work very closely with my DIOs, reviewing the 54 program submissions we have for ADS update every year. I typically do the block schedule part. That's the part I look at for them. But reviewing our 54 programs and areas that tend to get flagged more, plus this will be information also from the ACGME conference this past winter, the areas that are more likely to get you in trouble in the ADS update. So I'm going to start with a quick story that my DIO likes to tell, and I think this is a great thing about what they're looking for in ADS. I don't know how many of you are old enough to remember Van Halen. I certainly am. And how many of you remember about the rider clause that they had when they did concerts about brown M&Ms? Does anybody remember that? You can come off my mute if you remember that. Okay, so Van Halen had a clause in their rider that stated that any concert venue they went to, in their dressing rooms, they had to have a bowl of M&Ms, and every single brown M&M had to be removed. And for years, they got just picked apart for doing that. They were divas. They wanted too much. That's ridiculous. Some poor kid had to sit there and pick through the brown M&Ms. But when it came down to it, David Lee Roth later explained it wasn't about the brown M&Ms at all. They had all this really expensive equipment going in, all these pyrotechnics, all these very expensive instruments, all this setup that had to happen. And they wanted to know that that venue could pay attention to detail. And by making that brown M&Ms their attention to detail, they could tell you if that venue was going to take care of that big equipment. If they could get that detail right, they were going to take care with the bigger equipment. So I thought this was a great analogy of why the ADS and your annual submission is like the brown M&Ms to the ACGME. They're looking to see if you can get those little details right. And if you can get those little details right, they are saying, hey, you've got the big picture and you're doing the big things right as well. So for those of you who don't know who Van Halen is, and I'm sorry, that makes me sad, but anyway. So that being said, one of the nice things about your annual submission is 90% of you, they will not really go in dig deep. You know, they have the consent agenda. If you have your numbers look good, your surveys look good, everything looks good, you just go on the consent agenda. They don't start digging through everything to find smaller details. But for those smaller, that smaller percentage of programs that are having issues, you've got a bad survey, your board pass rate is low, you've had multiple complaints to the ACGME, you're going to be assigned to a reviewer. And that reviewer is going to go into your annual update and they're going to start looking at every single little thing. So they're looking for the brown M&Ms, right? And that's where you don't want to give them ammunition. That's where you want to make sure you have all these small things taken care of so that if they do start digging, there's nothing there. So a lot of these are pretty simple when you think about them, and Amanda and Becky are going to go over them later and making sure you get them right. But the biggest thing is missing or inaccurate data. According to the ACGME, and this is word of mouth, exactly what they said, word for word. If it isn't listed, it didn't happen. We tell our residents all that time, right? If it's not documented, it didn't happen. So making sure things are actually in there. Scholarly activity, are they in there? Are they accurate? We're not talking about numbers today, but I know last year there were quite a few AFIs entered, given to family medicine programs because of numbers not being accurate. You know, we were all struggling to get those reports and get the accurate data, but those are areas where you really need to make sure you have a really good relationship with your IT department or whoever's pulling those numbers for you so they are accurate. Another area that you will keep a citation instead of getting a new one is if your response to citations aren't strong. And they have a whole section in their ADS update talking about response to citations and what they're looking for. So let's say your block schedule last year didn't have a required rotation on it. It didn't show you had pediatric emergency medicine. And so you fix it and you just say, well, we've always had it, it's there. That's not the response to citation. You need to do a robust response to citation that there was, you know, it's inadvertently left off. Residents are going to blah, blah, blah institute, getting blah, blah, blah number of patients for the last 5 years. So make sure those responses match what the ACGME is looking for. Another area is in your major changes. That's your chance to really talk to the ACGME. I think everybody says that now. That's where they really read and look for. So another area that might get you dinged is if you don't respond to those areas for improvement. Not responding to negative survey trends, especially if it's year over year, or maybe you have a sudden really big drop in something. Then you want to talk about why you had a drop. What is on your action plan to fix it? What is your plan going forward? What is your timeline to fix the problem? Make sure you put that in there. And then in the following year, make sure you put the outcome in there. Yes, we saw an improvement by 0.2%. We're still working on it. No, we did not see improvement. We're pivoting to try something else, but make sure you put those in there. Another one is your block diagram. We did have a program here that got a citation for their block diagram. Again, it was one of those programs that had some problems since they were digging. And when they got down to it, the residents didn't have, this was not a family medicine program, it was a different one, but they didn't have the exact right number of days in clinic. Their specialty required that you put how many half days they had in clinic per year. And it was missing like 2 half days or something really small, and they got a citation for it. So make sure that's accurate and make sure your participating sites in the ACGME matches what's on your block diagram, and we'll talk about that later. And make sure that your participating sites that are on your block diagram are actually listed in the participating sites part of the annual update. Another one, small, you know, not updating the PD licensure, you know, making sure that all the information in your PD CV is updated. That's another one that can get you. They do look for that. You know, it was fantastic for those of you that predate the board certification. Boy, that was a pain every year, having to make sure and go to all the different boards for all the different faculty to make sure their boards were updated and you had their right expiration dates and they were in MOC and all of that. Well, now that they actually upload from the boards, you have to go back and double check. Are they in there? Especially for the newer ones, did they upload? If you had put them in manually and then they upload, you need to remove the manual one. So there's a little bit of activity there that you need to make sure is accurate. And then again, scholarly activity, making sure that you're capturing that scholarly activity. Luckily, faculty's gone away, but I would still keep track of that, make sure you have it. But for the residents, you don't show lack of scholarly activity. So these are the common ones that we see just simply from the ADS update that might get you a citation. Anybody have any questions about that or any other areas that you've noticed? All right. I have struggled with this year with some of my team members understanding the block diagram versus your block schedule or your rotation schedule. They are very different entities. I had to send one back because, and you'll see this later, the numbers were all in different order. And so I reached out to the program director and program administrator and I said, hey, you need to put all of site ones together, all of site twos together, all of site threes together. And the program director's response to me was, but that's not how we do them. They happen in this order and I want them in this order. And I'm like, well, I understand. And that's great. You can put them on your website that way, but the ACGME does want them in this order. So, making sure that you understand there's difference. It's the high level overview, your block diagram. It's standardized. It shows how you're meeting the requirements. It's your typical curriculum. It's not for special curriculum. It's a fixed template. It's external facing. And it's used, and you use your specialty naming conventions. Why is it important? It demonstrates you're compliant with their accreditation requirements, right? It shows that they are getting those required rotations and they are meeting your, the Family Medicine Board requirements. It also is a blueprint for your block schedule. So it is a way to kind of make sure you have coverage, make sure you know what they're supposed to have in 1 year. It also prevents compliance risks. So if you're missing a rotation, you can get a citation again. And then it supports data accuracy again. So it's showing like, this is what we have here. This is what we have here. You're showing that you are consistent and you are making sure those brown M&Ms are pulled out. The other thing, it can be used for recruitment and marketing. It can be used, we use it a lot to look at institutional oversight, who's going where. CMS actually has been pulling from it. I don't know if anybody's had an audit, but actually CMS has been looking and saying, hey, you're saying you're going to this hospital, but we're not seeing that. So make sure those are up to date as well. They do look at that. And it can be used for grant application and funding. And then it also can be used for legal documents. So just make sure it's accurate and up to date for each year. Where do you start? I don't know about y'all, but I'm still working on that new menu for ADS. It's still not my favorite. I sound like an old person who doesn't like change, but it's not my favorite. So you go into your program, you go into your sites and block diagrams, and then this is what pulls up. It'll pull up your your sites, participating sites, as well as who the site directors, how long they're at each place, are there required rotations there. And then you have to drop that little complete button to open it up and get to where you're going to upload your block diagram. But before you do that, look at your participating sites and make sure they're the most up to date and they're accurate. Any sites listed on your block diagram must be listed in participating sites. Any new or deleted sites must be approved by your GMAC prior to adding them into ADS. So rotations technically should not begin until you've had approval to add that site to your from your GMEC. You might need to update site directors, make sure those are accurate. Maybe you had a site director retire, maybe you had somebody else take over, make sure those are accurate. Double check all the participating sites, the questions that they ask for accuracy. How many months are they there? What are the resources? What is the educational component that's happening there? And then again, like I said, make sure the rotation months align with the block diagram. That is one area you will get dinged. If it's different, that's another area for citation. And then I can't stress it enough, follow the template. They give you a template of exactly what they want. So within that, there's that drop down. You can click that complete drop down. There's the instructions and samples. They'll show you exactly what they want. They have a 12-month sample, a 13-block sample. I think they have a quarterly sample. I think some of the programs that are doing longitudinal, it gets a little trickier. I actually put in a request and said, I have 2 different programs that do longitudinal curriculum. And I was like, is there a way you can give us a sample of what you would like for longitudinal? Haven't heard back, but something to think about. And then get organized, make sure that you've got your template out, you've updated it, you've got the accurate information on there, and then just start with your current academic year and go through. What I would do to make sure is I would pick a resident that I knew that just did our typical normal schedule, go through, make sure there was nothing different, nothing new that I needed to add. And then I would lay it out what they did that year. So they did, in their PGY 1 year, they did derm, they did inpatient, they did night float, they did outpatient pediatrics, and I just laid it all out. And then I listed where they all happened, and then I would put them in order based on that site 1, site 2, site 3 from your ADS. And then you go through, make sure it's all there, make sure you have all 13 blocks or 12 blocks or however many you have, and then go through to the next one. The other thing you're going to make sure is that you've updated the percentage of outpatient, is vacation percent permitted on that rotation, percentage of research that takes place on those rotations. So make sure that's all updated, and then go through and repeat for PGY2, PGY3. And then add any additional notes that might explain something. So if you have, let's say, a longitudinal geriatrics curriculum, you put that in the note. Residents in their PGY2 year do a 12-month, geriatric longitudinal curriculum at site 2. Put the choice of electives in the notes. So make sure you have residents may choose from the following electives. And then put your vacation policy. Residents receive 20 days of vacation, 13 days of sick leave, or whatever your policy has, and make sure that's all in there. You can also, if you put things in, if you have a different word, make sure you include a key. If the way you label it's not very clear. So if you call it, I don't even know what example to get, but just make sure your key is very clear of what rotation is happening. So any abbreviations that you use, things like that. Make sure those are very clear in the notes section. And then this is what it should look like. All of site 1 grouped together, all of site 2 grouped together, all of site 3. And then electives do not require a site, nor do research rotations. So you do not have to put a site. They can be at the end, and you can just have elective and open on that. Again, you can see how much outpatient takes place, how much research. And these are just examples of a 12-month and a 13-block rotation block diagram. And this is where you go back in and make sure that it adds up correctly. So you're saying that they're at site 1 for 9.5 months. They're at site 2 for 3.5 months. They don't go to site 3, site 4, or site 5. If it doesn't add, if you use the 13-block schedule, you can say that. You can say at the bottom in that note section that you use a 1340 block schedule, and that's why it doesn't add up to 12 months. So it must equal 1 year, but you can add that note if they don't. And then once you're done, you upload it, your PDF, and you are ready to submit it, and you're good to go. So the key items to think about is this is the visual representation of your curriculum. That's all it is. It's not your schedule. It should be very easily understood by a reviewer. So if I come into your program and look at it, I should very clearly understand that in their PGY 1 year, they're doing derm, they're doing inpatient, they're doing night float, they're doing outpatient peds, they're doing general surgery, they're doing cardiology. I should be able to see that when I look at your block diagram. And look, they're doing it all at Miami Valley Hospital. You can see where they're doing it. No nicknames. You can have those internal nicknames. You can have the green team, the blue team, the red team. You can have the nicknames. Just make sure that's not on your block diagram. No acronyms that don't make sense. So make sure that you're, PEDS, yes, everybody knows what PEDS are. ER, yes. But make sure you don't use an acronym that doesn't make sense or that's specific to your hospital. And then again, just a reminder, because we've seen this happen in our system, is do not use your new sites or rotations until they are approved if it's a new site by your GMEC. And then the final one, I think is easy. Just follow the instructions. It'll be easy peasy, lemon squeezy. Any questions for me? All right, I'm not seeing any. Oh, I do see one. Sarah?
Yeah, Melissa, this is kind of off subject, but kind of on subject. So thank you for your presentation. That was a fabulous presentation. My brain just works like ahead of things. So I know everything has to match in like web ads and stuff like that, but when you go into new innovations, there's a block schedule in there. Does it need to be in there?
Your block schedule, which is actually the actual schedule of what the residents are physically doing, that should be in innovations. Your block diagram is very different. So think of your block diagram as something you can use year over year. It doesn't change. Your block schedule, however, will change, right? You'll have residents go out on maternity leave and you have to change the schedule, and you have residents go out, you have residents quit and you have to change the schedule. So that would be the difference between the two. So like, if your institution doesn't change anything and your rotations stay the same year over year, your block diagram technically does not have to be updated every year. You could roll it over year. Whereas your block schedule, you do change every year. That makes sense?
Yeah.
Anybody else? All right, turning it over to Joanna.
So my question is about participating sites. If you have electives that your residents go someplace other than the primary sites, do those get listed in participating sites or no?
They do not. If it's not a required rotation, you do not have to list elective sites.
Thanks.
Otherwise, most of us would have a lot of sites to manage. So think of it as that's your core curriculum, your core places that they are required to go. So, you know, in my system here, my family medicine program is based at Richland Hospital. So they are primarily at Richland, but they may do, I don't know, let's say neurology psychiatry. Let's say psychiatry. They do psychiatry at Baptist and it's required. So those are two sites that they have to have. And then they also rotate on a required rotation to the VA. So they would have to have those 3 sites. So that would be the sites they have to have listed. But they can also do a rural elective in Sumter, and they don't have to have that listed. Chelsea?
Yeah, so in in the block diagram that you showed, like you had one block as like elective vacation, so it did not have a site. Do you just put that in the comments and when it has like how many months at each site that,
Yep.
because obviously that's not going to equal up to 12 then, or 13 if you have 40-week blocks.
Yep. So you can say residents this program follows a 13 block 4-week schedule, and residents have an additional block of elective time or research time, or however you do it.
So like, let's say you had 13, so for that year it would only equal to 12, and you just put
Right.
that.
But it still looks like you're at 12, but I would still put it in the notes section just so it matches when they pull them up.
Okay.
Yep. And so like I have one program that has a 1 year of research in year 1, 2 months of 1 month in year 1, 2 months in year 2, 3 months in year 3. And so it says that very clearly in the notes. PGY1 has 1 month of research, PGY2, 3, that kind of thing. All right, thank you all. And I will turn it over to Amanda.
Thanks, Melissa. All right, everyone, I am going to be going over the part of WebAds where you're entering your resident and faculty information. So first, I'll show you entering resident information, entering your faculty and program director information, and then some of the common citations that will happen on this side of it. Can you all see my screen? Sorry, I should have asked this. So once you log in under your residents, you'll see this list that has resident information, faculty information. You'll see on mine here where I have it's green because I have all of my residents in there currently. If you had missing residents here, this would have the exclamation point. The update scholarly activity for each resident, confirm ultimate certification status for graduates from 7 years ago is also red. So you'll go to add the resident, you go to the main screen and you hit let me go back here. On this screen, you'll go to view, and then when you go to view, you'll get to this screen where you can add a resident. You can add them now if they're your new residents and you've matched with them through the NRMP. They are listed. They should be listed here. You can just hit select. If they're not listed there, you can also put in their NPI and then search for them here, and it'll pre-populate their information. You'll just have to add in their date of birth and verify their social security number. Then once they're all entered, you'll have a screen like this that lists all of your residents And then once you've got all of them entered in, you'll see on the side where I have here the active residents and that we are 777. So everything, I've got my my graduates have been taken care of after the case logs are entered. I finalized and archived their records, and then so you're back to your normal, your required amount. So you'll notice here at the top where it says residents on your roster are missing required scholarly activity. So I need to make sure I've got their scholarly activity entered. So back on the screen where we started from, you'll go to the little tab here where it says view update scholarly activity information. Click on that tab and it'll bring up a screen here like this. So these are the different types of scholarly activity: the PMID, other publications, conference presentations, chapter textbooks, participated in research, and teaching presentations. At the top here, the little I, if you hover over it in the ACGME, it'll give you the information of what qualifies as each item. Like for the PMID, you have to have like the PubMed identification number for it to count, like that it's an actual documented item. So you'll go over here to the options for each resident, click on that, and it'll take you to a screen like this. And so here's also where it gives you some more information about the PMID lookup, the other publications that are not PMID, but they're non-peer reviewed publications, conference presentations that are not like a grand rounds. These are abstracts, posters, and presentations given at an international, national, or regional meeting. Chapters and textbooks, participated in research, is just a yes, no question. And then the teaching presentations, which does include lectures or presentations such as grand rounds or case presentations of at least 30 minutes at your sponsoring institution, is a yes, no. Thankfully, this used to be a number question, which was a complete pain. So I entered in that my resident completed, our residents do grand rounds in third year, and then they do a lecture case presentation during didactics twice during each other year. So ours are generally just a teaching presentation. So I've completed that. You'll see that once you do that, it's not read any longer. And so you've got those ones are entered, and you just continue to go down the list. Does anybody have any questions regarding residents? Okay. So I'm going to move on to the faculty information. So in the same spot where the residents and faculty on the main page are listed, you click under faculty, and then you'll go to view to enter the profile information for all of your physicians and non-physician faculty. We have a pharmacist a clinical pharmacist who works in our program. So he's entered here as a non-physician faculty. And then you identify your core faculty, and then you enter all of the required information for your program director CV. And so this is a list of our faculty. This is just showing this is what your list should look like with your active faculty. If you have people on this list that are no longer with your program, this is where you would remove them. And you just have to put a date like when they last stopped working with your program. If you have new faculty added, you would go to the little add faculty button. You can add faculty at any time during the year. You don't have to wait until this time of year, the end, right when you're updating the web ads. You can, update them right when they're starting or when they're starting, and you just have to have their information to be able to put in. So this is just general information that you're putting in. You put in their, their name, degree, their title, email, their NPI has to match, and that'll all save. It does ask you initially when they started in GME, when they started in family medicine. This is an example of the CV template that the ACGME prefers that you use. So a CV is required for all active physicians and non-physician faculty for new program applications. And once you're initially accredited, a CV is only required for the program director. And so it has, where they did their residency, their academic appointments, current professional activities, bibliographies, articles, participation in local, regional, and national activities, presentation, abstracts, and grades. And then these are the frequent ACGME citation findings. So during accreditation reviews, reviewers commonly identify that the CV does not demonstrate adequate scholarly activity for a program director. The publications are outdated, no recent activity in several years. Missing education scholarship, curriculum design, meta publications, educational presentations. The dates on the CV do not match your ads entries. The leadership roles are not documented. Board certification information is incomplete. Missing explanation of protected administrative time. Faculty appointment listed differently than institutional records. Missing evidence of ongoing faculty appointment and inconsistent employment history. And then there's a little chart of the area, the common mistake, and the best practice to keep track of those items: board certification, faculty appointments, employment dates, licensure, scholarly activity, leadership roles, educational activities, professional development, awards, and clinical responsibilities. The bottom line for best practice is, you see it over and over, verify and ensure that it's accurate before you submit the information. And then this is also just before submitting the ads, your program director CV. This is a good final review checklist confirming that all dates are accurate and consistent. Board certification is current. Licensure is active. Academic rank is current. Employment history has no unexplained gaps. Scholarly activity is updated ideally within the last 3 to 5 years. Educational and administrative leadership roles are included. Institutional titles match HR records, and the CV matches the information entered elsewhere in ads. One of the biggest reasons PD CVs generate follow-up questions during accreditation is lack of consistency. Reviewers compare the PD CV with ads, faculty data, institutional documents, scholarly activity reports, and program information. Even small discrepancies in dates, titles, FTE, or board certification can prompt requests for clarification. So consistency across all submitted materials is just as important as completeness. And I would say, no, I feel like too much information is not an issue. You'd rather have all the information that you think they might need rather than missing information. And that is all I have. If anyone has any questions, I'm happy to take questions. Okay, Sarah.
Yeah, we were looking over this, my program director and I, and we had removed and added a faculty member, and she had mentioned something that somewhere in ACGME program requirements, I'm not exactly sure, that there is a faculty listed in like an order that they should go in. Are you aware of this? I couldn't find it.
I know in the past, so our program's been around for 14 years, or 13 years. And I know there was an order list of Melissa, do you know, is that still a thing, or does it necessarily matter?
I think it's gone away because the specialties that still have that order list, it's actually in the information above the faculty where you would add faculty, above your faculty list. It tells you what you need to add.
Yeah,
Like
that's
in
what I thought. That's where
ACGME, like in the WebAds
Yeah.
part, right?
Yes.
Okay.
Yeah, that's
I
where
And I
didn't
can
find
show
it
you-
there, and I
I-
didn't find it in
let me see.
ACGME like in anything. So
Let me
I
see if I can find one. 'cause
It
I
used
know
to be
for-
in an FAQ somewhere, like at the beginning of like the family medicine program requirements, the little FAQs. It was in there 1 year, but that was a couple years ago, I think.
Yeah, because you used to have to list, like, they had it like in order. They wanted your core faculty and then they wanted those specialties that they needed. Yeah. But now, if I'm not mistaken, I think pediatrics is one. It's in the, like, right above where you would have your faculty roster. It's in there that says you must have these specialties and all that.
okay.
Yeah, I noticed it wasn't there any longer, and mine was originally set up that way, so I've just never made any changes to it. I kept it, in that order, but it was up at the top where, let me see, I'll share let me share my screen really quick.
Yeah, if you could share your screen. I couldn't find it anywhere, but
It used to be up here where it would tell you, like, list your faculty members in order of, like, up in this
oh,
little
okay.
section, and it's
Okay.
not there anymore. Is that where you remember it being, Melissa?
I can show, yeah.
Can you hear me?
I'll show you these.
Yes.
Oh, you can hear me?
Yes.
It does exist. It is on page 84 of the current ACGME requirements. There's an
It's in
FAQ
here?
portion at the end of the new requirements. And the listing of who to list is in the FAQs on page 84.
I think I do think there used to be an order that,
there was an
so I think
order.
you have, now you can list, you do need to list a certain amount of this, there's a requirement of who you should be listing,
Yes,
but not
but
the order.
Page
Not the
84
order.
has the order in which, like, what specialties you're supposed to list them in order of.
Okay, do you have it still? Because, and you really should, submit to the ACGME and to, like, Eileen and, a request that it goes in this area, because if you see your PEDS has it in that area, so you can see it as you're making your faculty roster. So I would definitely make that request.
Yeah, because I know it used to be for family medicine, that is where it used to be. The listing, it would tell you what the proper listing was for, putting like ICU, critical care doctors, peds. It was all a certain order.
So I
that
need to
Vic-
look
Vic-
in the FM common program requirements then on page 84, you said?
Victoria, are you able to share your screen?
Yes, give me 2 seconds to
Sometimes
if I can
if people
do that.
see it, it's easier for them to recall where it's at.
I have it pulled up.
Okay. Yes.
Are you-
So I see someone sharing their screen now.
Okay.
In the Q&A right
Right here.
there, it says after faculty medicine faculty members of program have been entered, identify the individuals responsible for teaching family medicine residents in the following areas, and it says listed in this order. So you have to have human behavioral health, followed by adult medicine, followed by cardiology, followed by critical care, etc. So that is the listed order they wanted in.
That's a very confusing thing too, because the question is about non-family medicine faculty
Right.
members.
So basically they do want you to list all of your fam med faculty first, and I would
and then-
assume that they probably want you to, like, list your, like, program director, associate program director, and chair,
Your
followed by
core and
core
all that,
faculty,
yeah.
followed by non-core. But yeah, the non-FM faculty teaching in these other areas, this is the specific order they do want it listed in.
Y'all
There you
always
go.
amaze me. I learn something new every time I get on a webinar. Thank you so much.
I'm not joking when I say you should request that it's at the top of the faculty roster.
Who-
He
Yes,
did.
I never does that saw need to that go to?
before.
Like to Eileen or, who's the other one?
Sandra.
Sandra Benitez.
Can you provide their email addresses? I don't have them.
You know what? I'll
It's
put
on
in
the
request.
ACGME website.
I can put in the request.
Oh, that'd be perfect.
I can do it.
Thanks, Becky.
I got you.
And thank you,
All right.
Victoria, for showing this, because I had no idea that was there either.
Right? Awesome.
Well, it used to be a whole different document because when they updated the requirements this year, I noticed the FAQs document just disappeared completely. And so I went digging for it and found that they just tacked it on the end there. So.
Right. God bless. All right, let's see here. Everybody see my screen?
No, not yet.
Not yet.
Oh. Let's see. Do it over. How about now?
Yes.
Are we seeing just the PowerPoint, or are you seeing the presenter mode?
I just see the PowerPoint.
Awesome. Okay. Hi guys, I'm Becky Webb. I am institutional and residency or program coordinator at LaGrange Family Medicine in a suburb of Chicago. We are a 777 program, community hospital sponsored by an osteopathic medical school. So I'm gonna kind of go over the osteopathic recognition stuff that comes up in WebAds, just to kind of give those of you that are osteopathically recognized an overview of what that looks like. So, all right. See if I can get to the next slide. That would be great. Okay. So this is what I plan to go over: osteopathic recognition, WebAds updates, how to make sure your residents are osteopathically recognized in the system, faculty, same thing, how to designate your director of osteopathic recognition. And I also put in a screenshot of my block schedule that Melissa was talking about with the osteopathic recognition information. And then I just was able to actually add, while you guys were seeing somebody else's presentation, what it looks like if you're osteopathically recognized and you have osteopathically recognized residents, and what questions during the scholarly activities section that they ask you regarding OR. So I was able to add a screenshot of what that looks like also. All right, so on WebAds, this is what the page looks like where osteopathic recognition is. It's extremely easy to miss. It looks like it's just information, but there is this view button on the right-hand side. So programs with osteopathic recognition are responsible for reviewing this, as well as updating any of the related information. And it, like I said, it's hard if you're scrolling too fast, if you don't get into WebAds early enough within the time frame, you might find yourself rushing past this and you might miss it completely. So, and there's no hard stop to make sure that you do this. So make sure, if you're osteopathically recognized, that you actually look for this. You can click this view button and it takes you to this page. So your program information should be on the top. It should say osteopathic recognition. It should give you your status, all of that kind of stuff. And then to view a current copy of the program osteopathic recognition summary, you're going to click on this summary. Your osteopathic director may want to click on this so that they can see what was in there from before. And then moving on with that, in order to manage designation of residents and osteopathic personnel, these buttons can be pressed. And it will take you into different screens. So on my next page. So when you click on manage residents, this is what your screen should look like. It should have a list of all of your residents, active, and then their educational focus should be here. Now, if you see that this resident is not supposed to be osteopathic, they've opted out, or whatever it is with your rules, if you scroll down on this page, which I didn't include in my screenshot, and I apologize. If you scroll down on this page, there is a place where you can click this box, and then you can click whether or not they're program and osteopathic, just osteopathic, or just a program resident. So it's like a drop down, you'll be able to click it and then you can save it up here. So you want to make sure all of your designated osteopathic residents are listed here as osteopathic residents. That is what prompts their scholarly activity and all of that other stuff to come up. So this is the faculty section. So if you go back to that last page here and you click manage faculty, this is what it will look like. And the same thing, you click the box, you'll be able to change the educational focus of the faculty, make sure all your osteopathic faculty are listed as osteopathic faculty. Because then that will also bring up the requirements in scholarly activity for faculty and all of that too. So, and then this is that Director of Osteopathic Education button right here. This is what you will get when you click on that button. So it's going to tell you what your instructions are. It's going to tell you what the requirements are, qualifications for an osteopathic director. And then you have the option of saying, yes, my program director is the faculty member functioning as the director, or you can say, no, this is the osteopathic faculty member. And you can click on a drop down and it will list all of your osteopathic faculty and you can pick which one is the director. And then you, of course, want to make sure you hit that save button up at the top. So this is a copy of our our block grid with our osteopathic information on it. So if you can see here, my sites, site 1 is my hospital, site 2 is a different hospital, site 3 is a different hospital. So I have those in here in the order in which, like Melissa had said, percentage of outpatient in each one of those, which is a requirement, percentage of research in each one of those. I have my first, second, and third year. And if you look down here, it says elective rotations can be in any subspecialty. And then I listed my subspecialties that we do electives in. And then there's also this little symbol guide down here. There's an upward arrow for osteopathic education experience and clinical training and osteopathic clinic, osteopathic manipulative training clinic, and then osteopathic didactics and OMT hands-on labs. So I put those little asterisks and all the little codes right here in each box underneath the individual rotations. And that tells them where we have osteopathic recognition. And our duty, or like the things that we do for osteopathic. So that's what our block schedule looks like. And then if you have osteopathic recognition and you've deemed a resident as osteopathically recognized, when you go to enter their scholarly activity, there's separate questions that it asks for osteopathic. So it's going to ask you all the same questions they do for a regular resident with scholarly activity. But when you click on yes, or you put how many, it's going to ask you how many of those presentations included integration of OPP, osteopathic principles. So you will have to respond to that. Now there is requirements for osteopathically recognized programs that I believe it's 1 of 2 of their regional or scholarly activities have to do with osteopathic manipulation or osteopathic principles. So number 1, urge your residents to add even a quick line in how it connects to osteopathic principles when they're doing research projects. And number 2, just make sure that you're capturing that and keeping track of it. And if you keep answering no over 3 years, your residents are not going to be ready for graduation at an osteopathic recognition level because they're not meeting those standards. So make sure that you're capturing that correct information on this list. So, the easiest way to do it is, did any of this research incorporate osteopathic medicine? And you just have to click yes. And then it will ask you if they did teaching and presentations and did any of those incorporate osteopathic medicine. So you can click yes or no here. So that's kind of how you incorporate that osteopathic recognition into the scholarly activity. And I am done. Does anyone have questions regarding osteopathic recognition for me? All right. Fantastic. All right. Anybody have questions about anything that we didn't cover that we may need to answer questions on, or maybe you want to share some information that made things easier for you? Any of that. Awesome. Well, I hope we did some good for you guys. I hope this helped with any anxiety you might have been having filling out the web ads. I know they extended the deadline this year. I believe the deadline is September 18th or something like that. Hopefully, yes, September 18th is the deadline. I know that the osteopathic sorry, I know that the institutional stuff was already due, and you should have already archived all of your graduating residents. So that happened on August 1st. But you do have till September 18th to get the rest of this. Hopefully we were able to help you out there. I want to wish you guys a really great week, and we'll give you 6 minutes left. 6 minutes back in your day. Thanks so much for coming. Have a great day, guys.
Bye, ladies.
Guys, thank you so much. I appreciate you.